Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the September 24th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 3,083, which is 567 new cases since my report last Thursday and 269 since Monday's report to the City Council. Just today's total is 134 new cases, which is the largest number of cases by far reported on a single day here in Dubuque County. I'm sad to report an additional death this week, so the total number of COVID-19 deaths is now 41 in Dubuque County. About 11% of almost 29,000 people tested in Dubuque County have been positive overall since March. And the 14-day average positivity rate is 16.5%. Up from about 12% last Thursday. Unbelievable. As of September 22nd, 15 Dubuque County individuals are currently hospitalized in Dubuque County, and 63% of Dubuque County positive cases have recovered to date. The increases can be attributed to community events, K-12 schools and local colleges and universities being in session, along with nursing homes testing weekly, and generally community spread of these positive cases. The state added 2,840 cases since Monday, September 21st. So as of September 24th, 2020 at 2 p.m., Iowa has a total of 83,573 positive cases. 11% of Iowans tested have been positive overall, and the state 14-day average positivity rate is 9.2%. Deaths reported in the state total 1,302 Iowans. And currently, 305 cases are hospitalized throughout the state. That's increased from 271 1 week ago. Finally, about 74% of Iowans have recovered. Our incident management team now has additional data and metrics from the Iowa Department of Public Health to help manage the pandemic response. This includes more refined data on the ages of positive cases. As of today, the age group with the highest percentage of cases is those 19 to 24 years old, with 21%. If you group the three age groups with the highest number of cases, it shows that those aged 15 to 29 years old make up 39% of all positive cases. Children 0 to 14 now make up 5% of the cases, so it's clear that young adults are most affected by the recent increase in positive cases. But middle-aged adults from 25 to 49 make up 33% of the cases. No longer is this virus just affecting nursing home residents and the elderly or other special populations. Why does that matter? Well, I'm sure you've heard the newest COVID-19 term this week in the news, the long haulers. Those people who have met the definition of recovering from COVID-19 and are no longer infectious, but are still suffering from lingering ill effects such as chronic fatigue, body aches, difficulty concentrating, chronic cough, shortness of breath, cardiovascular symptoms, changes in smell and taste sensation, gastrointestinal symptoms, and on and on. And COVID-19 is not the only virus we've known to have had lasting health effects on people. We're still learning what the lasting effects will be, and as we experience this recent surge in the youth and the young adult population, we will have to wait and see if long haulers will emerge from these groups, as they're already starting to. And for the most part, young adults recover with few or no symptoms. At least that's what's showing up now. So a lot of people think, what's the big deal with that? The risky thing about this age group is they're more likely to be out in the community by attending school or college, participating in athletic events, and socializing more with members outside their own household, and community events and other social venues. Plus, it means that many people who are exposed to these individuals will be absent from school, work, or forced to stay home to care for young children who are either ill with COVID-19 symptoms or quarantining. And those people, who may be family members or co-workers of those young adults, may not be so lucky and experience more symptoms with greater severity and possibly become a long hauler. That's why it's a big deal. Our increased cases have caused many more questions about quarantine and isolation, along with situations and exposures and re-exposures becoming more and more complicated. So, In the interest of slowing the spread and decreasing the incidence of more positive cases, let's review quarantine, isolation, and their requirements. Quarantine is what you do when you're exposed to someone who tested positive or has symptoms of COVID-19. In other words, quarantine is used to keep someone who's had an exposure to COVID-19 away from others because we know that it may take up to 14 days for symptoms to develop. This is called the incubation period. Quarantine helps prevent spread of disease that can occur before a person knows they are sick or if they are infected with a virus without feeling symptoms. The incubation period for COVID-19 is 2 to 14 days, meaning if you have an exposure, it probably won't show up on a test for about 2 days, but it could take as long as 14 days. People in quarantine should stay home, separate themselves from others, and monitor their health for 14 days. So what if you get a test during this 14-day period and it's negative? Doesn't matter. You still may show up positive later during that 14-day incubation period. Now, isolation is required for symptomatic or those who tested positive for COVID-19. Isolation protects infected people from spreading it to others. We know that you are no longer infectious after you meet the following criteria. At least 10 days have passed from the day symptoms started or the date of the positive test, and you remain fever-free without the use of medications for 24 hours, and your symptoms have improved. In the home, anyone sick or infected with COVID-19 should separate themselves from others by staying in a specific sick room or area and using a separate bathroom, etc. It is kind of confusing because people who are exposed have to stay away from others longer than the people who are sick or test positive, and that doesn't seem fair or logical, but that's the way it is. So how long should you isolate or quarantine? Let me show you an example. Here's our famous quarantine calendar. So if you are exposed on day 1, you came within 6 feet of someone who had positive COVID-19 test or symptoms for greater than 15 minutes on this day. So you count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. This is the day. You start here. This is the day you're done. 14 days. Okay, so what happens if you're exposed here and you start your 14-day quarantine period and then, on day 7, you get a fever, a cough, or some other symptoms of COVID? It's at that point you have to start your 10-day isolation period for 10 days because you're sick and you could pass it to others, and you can be out on the 17th. So that can really lengthen how long you're away from people. But it's very important to know that even if you tested negative here, you can still show symptoms here, and then you need to extend that isolation period that you moved into because you're positive for the 10 days, 24 hours fever-free, and symptoms improved. I know this is very confusing, and believe me, I still have to review several sets of guidance before answering some of these tougher isolation and quarantine questions. The CDC website has these calendars and explanations, so you can always refer to them for a review. One other news bit, starting Monday, Dubuque will have an additional Test Iowa option at Grand River Medical Respiratory Clinic at 1400 University Avenue in Dubuque. Hours of operation will be Monday through Thursday, noon to 7 p.m., and Friday, noon to 5 p.m., by appointment only and scheduled online through the Test Iowa website and by filling out the Test Iowa online assessment. Their hours will offer different times than the Test Iowa site at Epic Health and Wellness, which will increase testing accessibility in our community. Finally, we're officially into the fall season, and as we start to enjoy fall activities such as hiking, leaf viewing, and visiting apple orchards and pumpkin patches, let's make sure to do these things safely and be aware of our rapidly increasing spread of COVID-19 here in Dubuque County. Thanks for tuning in today. Remember, you cannot test your way out of quarantine, and we're all in this together.